Good evening, everybody, and welcome back to our People of Hope series, coming to you from the Bernardin Center at Catholic Theological Union in Chicago, Illinois. I'm Steve Millies, the director of the Bernardin Center, joined by my colleague Peter Cunningham, the associate director, and we are very glad to be able to come to you with this weekly series to talk together about what's going on, how this crisis is affecting us, to have an opportunity to reflect together, but mostly to have an opportunity to be present together as we are, for the most part, confined to our homes. It's always a great pleasure, and in fact, I would say a joy to be with you. For those of you who are coming back, we're glad to see you. For those of you who are joining us for the first time, welcome very warmly. We are glad you are here. As always, I want to begin just by showing you a little bit some of the resources that we have available here relating to this series. I'm sharing my screen here you can see the People of Hope webpage that you can link to from the Catholic Theological Union homepage, ctu.edu. And here you will find, oh goodness, look at that, I've got the wrong page up. Here you will find, oh doggone it, there it is. Here you will find a listing of our upcoming events. There's tonight's event, Faith, Action, and the Color of COVID. Next week, we'll be joined by CTU's Marian Diaz, who will talk to us about discernment and decision-making in uncertain times. And very soon, we'll be announcing 3 more programs that you'll be able to find information about here on this page. If you scroll down farther, you can see the videos and the resources that have accompanied these programs up to this point since we began on March 24th. And if you click on subscribe with CTU here, that will take you to this page I began with, where you'll have an opportunity to engage with CTU, to link to our Sunday scripture reflections, our regular newsletter, to see some of our upcoming events, to subscribe to some of our newsletters and choose the subscriptions that you might like to have. And of course, we are always grateful if you can click that Support Today button and help CTU out during this time as well. Of course, only if you can. Tonight's program is going to have some different ground rules from our earlier ones. We had a program last night that we co-hosted with Commonweal Magazine, and we had our first Zoom bomber throughout this series of events that we have put on. We had someone come in and say ugly things, and we were able to eject them rather quickly. But nevertheless, it's forced us to re-examine some of what we're doing here. And the thing that's going to affect you most is you no longer have the ability to unmute yourselves. So when we come down to the Q&A at the end, we're going to ask you to use the raise hand function, which you can find by clicking the participants button at the bottom bar of your menu. We'll talk a little bit more about that when we get down to Q&A, but for right now, that's going to be the thing that's going to affect you most. I don't anticipate any trouble tonight, but if there is any, we've got 2 people who are looking for problems and we'll be solving them very quickly. And in fact, I want to thank Ron Brown from CTU, who's taken his evening to help us out with that. There are many aspects of this crisis that we're living through that are important. The impact that it's having on medical workers, the impact that it's having on schools and children and education, food and other shortages, and of course the health crisis that so many people are facing. And then there's our own loneliness and the trauma that we're all experiencing throughout all of this. We don't want to look away from any of those things tonight or at any point in this series, but what we do want to do tonight with Faith, Action, and the Color of COVID is pay attention to a facet of this crisis that maybe we don't look at enough. I think perhaps because it corresponds to some things in American life that we don't look at enough. We know that there is a disparate impact in communities of color, in poor communities, in inner city communities that this crisis has revealed. And in fact, I think the truest thing we can say about the COVID crisis is that it has been a crisis that has revealed other crises. It's for that reason that we want to pay special attention tonight to that disparate impact. We want to look at it through the lens of faith. We want to look at it as seekers after justice that we are as believers, but we also want to look at it through a lens of action. How can we keep things like this from happening again? What can we learn? That's the direction of tonight's conversation. And joining me in that conversation tonight are Dr. Kim Lymore, who is the director of the Augustus Tolton Scholars Program at CTU. Kim is also a minister at the Catholic community of St. Sabina on Chicago's South Side. With us also is Marco López, the director of CTU's Óscar Romero Scholars Program. Marco has worked for many years in ministry with the Archdiocese of Chicago, particularly with the Latino community and at CTU as well. Kim and Marco, I want to welcome you both and thank you for being here with us tonight. And I'd like to begin just by asking you to introduce yourselves, talk about your own ministries and the contexts that you come to this conversation from. Kim, could we begin with you?
Sure. Thank you, Steve, for having me on this evening. This is truly a pleasure. I minister at St. Sabina Church, which is located at 79th and Racine, which is in the heart of the inner city or urban area. This is the Auburn Gresham area, but it kind of borders also on the Inglewood area. I've been at St. Sabina for well over 30 years, but I've been a pastoral minister for 20. Basically, we are we do a lot of outreach to the community. Our pastor feels that not only our parishioner, our congregants are our main focus, but also the community that we reside in. We don't pay taxes, being a tax exempt kind of corporation or entity. And so from that standpoint, that because we are there located in that community, that we should be more of a blessing to that community than a hindrance, since we are not paying taxes for that. So we do a lot of outreach. We have a social services that gives out food and clothes. We have an employment resource center that helps people get jobs and have job fairs. Currently, they are also giving people access to computers to our tech center. And I think we'll get into it later on. There's also a digital divide, not only in most of your Black and brown areas. Most people don't have access to the internet. There's food deserts in that area. So that's the importance of our social services, giving out the food. We have an ARC, which is our youth center, which houses our teenagers and our after-school programs. So teenagers are able, and kids are able to come and do tutoring and do crafts, and just as a way of escaping the normal life in the inner city of trying to be recruited by gangs. And so they are able to come into a safe haven in our ARC. We have a school pre-K 3 through 8th grade that is also there at St. Sabina. So we are in the midst of all of this, and as we get to talking and how, and you talked about, Steve, how this has possibly come up. We're talking about the color of COVID, when a few weeks ago, when it was the information started to rise that 30% of the African Americans make up 30% of the population, yet 70% of the deaths that were happening. And so that tends to rise up. Okay, well, the problems of food deserts and digital divides and access to healthcare and low unemployment and low employment and all of the issues that have always been happening due to situations have even more been highlighted during this epidemic.
And Marco.
Well, first of all, also thank you, Stephen, for the invitation, and thank you to all of you who came on board this evening. So as Stephen said, my name is Marco López, currently the director of the Óscar Romero Scholars Program at CTU. I'm also an active parishioner at Holy
Marco,
Cross. Yes.
Marco, could you speak up just a little bit? We're getting some folks who are signaling they can't hear you very well.
Okay. Is this a little better? Okay, thank you. Just got a thumbs up from Richard McCarran. Thank you. Currently, my parish is Holy Cross Immaculate Heart of Mary, which is in the back of the yards neighborhood, just about 5 miles west of CTU. And though my activity there currently is somewhat limited, that still continues to be my parish, but I've lived in this neighborhood for coming on 24 years this coming summer. But a lot of my work and my ministry over the years has been much wider, and that's really with a number of communities of that are Hispanic, Latino around the Archdiocese of Chicago. So the ministry in Pilsen and their village here in the back of the yards, and a lot of my work that I do with the Archdiocese takes me to some of the other neighborhoods, even into Lake County and some of the Southwest, and really, which is a reflection of the growth of the Latino community here in the Archdiocese of Chicago. I was very interested in this conversation in that I've been in a number of other conversations with people. I've been doing some reading and following. One of the things that I do regularly actually is follow the news in Spanish as well. And so those newscasts tend to report a lot more on the particulars of the Latino community than some of the other mainstream newscasts. But you know, I think this whole question of how is the pandemic affecting the Latino community is something that is very dear to me because of my involvement in ministry, and of course because of my own background as a Latino growing up here in Chicago. And so just want to begin by sharing a couple of things, some data that I was able to read up on, but which I think will help us to frame our conversation, at least a part of it, with as we reflect on the effects on the Latino community. So, and statistics vary, I'll have to say that. Statistics vary, of course, but at least one sort of, I think they're all in the ballpark of each other. One of the things that I think is striking is that the connection, and I think when Steve and Kimberly and I talked earlier this week, and Steve mentioned three things as we started. In this particular, or these two particular communities, the connection between being communities of poor, being community of color, and in the inner city. And so some of the statistics will support that. So I've discovered that about 1/3 of the Hispanic community, and I believe that's a national figure, lives in poverty. And about half are considered low income. So according to the government statistics, about half are considered low income. So also that about 60% of folks in our community that work earn less than $15 an hour. And that the Latino community has higher rates among the lowest paying jobs as well. And then maybe just one more statistic. I don't want to fill you with statistics, but one more that I think is telling, particularly for our conversation, is that about less than 30% of Latinos in the job market are eligible for either family or sick leave. So as we talk about people having to make choice between staying at home and caring for their children, and some who are deemed essential workers and have to leave the home. And I think there's much to be looked at there by way of how we, one of the decisions that folks have to make. The other thing, and we'll circle back around this, I just want to kind of lay out a framework for at least the conversation, is looking at the employment. And so the types of work that by and large Latinos, Latinas are engaged in certainly impacts how the pandemic is affecting our community. Also, and I think I'll let Kim speak to this as well if she would like, is because I think this is a common denominator with African American and Latinos, and that's how even going into this pandemic, the chronic health issues that our communities face, particularly two, I think, that stand out, which is which are high in our communities, being the diabetes as well as heart disease. And so going into this pandemic, many of our folks are already on strike too, if you will. And so I think we want to kind of come back to that. And then, so let me stop there for a moment because I've got other comments, but I think we'll work them into, we can work them into a conversation.
Yeah, I appreciate that. One of the things that's, I think maybe we'll want to delineate as we begin here is it's tempting to speak of this as just one crisis, but there are at least three crises at work, right? There's a health crisis, there's an economic crisis, and there's a social crisis, right? Bearing on the way that we live. And I want to be careful to sort of try to say as we go forward, we don't want to just sort of blend everything together. We need to really try to keep our eye on all of those different pieces. And yet I also want to be aware that, you know, as Marco is sort of suggesting, communities are impacted in different ways because of their own particular circumstances. Marco, maybe I could begin just by coming back to you for a moment and asking you to talk a little bit about the particular challenge that's faced by the undocumented community.
Yes, thank you. So probably the single most important factor that affects at least a large segment of our community, obviously not, you know, these days you hear the word immigrant and automatically many people think of immigrant as somebody who entered the country without inspection, but many of us are immigrants, and from that population, there's a certain amount that entered the country without inspection. We also call them undocumented and other words that I just don't care to repeat. But many of our folks who are in our communities who are undocumented, first of all, do not have access to healthcare. And so there's 2 points that I'd like to make with that. One of those is that, so already, again, their health may be compromised because they are simply just not visiting a doctor regularly the way many of us would. Also in these days, as people experience symptoms, for many in this population, one of the first things that will cross their mind is, if I do search out some health professionals, if I go get myself to a clinic, to a doctor, to a hospital, will I have to prove my status? Will they discover that I do not have legal immigration status in this country? And what will be the outcome of that? You know, is that going to then put me and perhaps my family in line for detention and or deportation? And so what happens oftentimes is the choice is, I'll wait this out and I'll try and just figure out a way to live with this. And so not only are they jeopardizing their own health, they jeopardize the health of the other individuals with whom they live with. Number two is the kind of jobs that the folks have. Again, if they are working here without legal documentation, then the likelihood is that they are not eligible for benefits. So things like I mentioned earlier, like sick leave, is just simply not an option. I think they open themselves up also for abuse, because at this time, when for many people, just having a job, having any sort of income is of primacy. People will work and do anything they have to bring money in, and that opens up the door for folks to take advantage of that particular situation. And then I think that the other group that I wanted to kind of mention, even within that group of people who are in the country without legal documentation, is those young people we call dreamers. So just to kind of, for the sake of everybody, in case somebody doesn't know, these are young people who were brought to the United States by their parents at a very early age 1, 3, 5, you name it. And right now, this current administration is proceeding with their plans that they've had for months, even prior to the pandemic, for doing away with DACA, which is the Deferred Action for Early Arrivals. that it was a program of protection for them that former President Obama signed and the current administration wants to get rid of. And I mean, as we speak, it's before the Supreme Court. A decision could come at any moment in which they lose their current protection, which means they're open season for detention, deportation, etc. So it's not specifically related to the pandemic, but certainly it is exacerbating the situation and creating the tension and the concern that is just piled on to what the rest of us are feeling with the pandemic.
Kim, I was so grateful that you began your remarks by talking about the work that is done at St. Sabina in the community. I oftentimes tell people that because I don't encounter a lot of people who know about the breadth of the services that are offered to the community there, from food to shelter to childcare. But as you know too, so many of those things that St. Sabina offers are needed on a scale that St. Sabina can't make. And there's only one St. Sabina. Maybe you could talk just a little bit in particular about what you have seen there in terms of increased demand and what perhaps might even surprise us if we're not thinking about what's happening in a community like that.
Okay. I don't know if there are a lot of surprises, but I know that as far as our food pantry, we have been giving out more food to people in need. Usually they are usually service based on zip code, but they've done away with the zip code, so anybody that needs food can come and get food. We've been helping just through some donations that we've gotten. We were able to help the increase and buy meats and different things that are needed, but the demand has been very, very high. So we give out food usually it used to be Wednesday, Thursday, Friday, but I think most of the time now it's just like every day. We have not been giving out so much clothes and other things, it's been concentrating on the food portion. So there's a great need of food. Our ARC has been open for kids, mainly because like even Marco said that most of African American and brown people and Latinos and everybody, we are essential workers. And so they can't afford to stay home and they can't work from home. You know, they don't have those type of jobs where they can work from home. So they're the essential workers that are out there that are not really recognized because we're thinking everybody's on the front lines with the healthcare workers, and by all means they are. But we have these other essential workers that are out there keeping us comfortable, so to speak. You know, we can go to the grocery store. We can take the bus. So there's different things with them. We still get our mail every day. So those folks are still out there on the front lines doing things. So we have opened our ARC. Now we probably have a few more kids than we probably should. But you know, it's a need in our community. We have kids coming actually from the west side. They take a bus and come over for 2 hours because their mother has to work, but they need a safe place to be all day. So they come over there, they get fed, they get breakfast, they get lunch, and they're open from 9 to 5. So there's the demand has definitely increased with COVID-19. A few weeks ago, well, not a few weeks ago, a couple times, last week and a week before, we gave out masks because now, you know, masks are going to be required going forth starting on May 1st. And so we got a donation from Willie Wilson on 10,000 masks. So we gave out the 10,000 masks in 1 hour. So that might surprise you. You know, they were in packs of 2, so, you know, about 5,000 packs. But we did it, they were gone in 1 hour. So people they're afraid, they're scared, they're trying to do whatever they can to protect themselves. And so they're out there doing that. We have some people, we can make an appointment to come to use our tech center because those that are unemployed have to try to get unemployment benefits. How do you do that? You go online to do that. Most folks don't have internet in their house. So that whole digital divide. is in play. The kids can't do e-learning because they don't have the MacBooks or the iPads or the Chromebooks or whatever they're using for that. And if they did, again, they don't have internet. So those kind of issues have constantly been arising. But people are afraid, and I think they're beginning to get a little discouraged. You know, they're having to stay, you know, in the house. However, even during the pandemic, there still were 55 homicides during April. So you don't hear about that as much because we're steady getting the COVID-19 briefings and stuff, but you're not hearing about the violence that's still happening in the neighborhoods.
You've both talked a little bit about the class system that exists, about essential workers versus those of us who have the capability to work from home. And I think that's important, but you've also both talked a little bit, or at least you've mentioned the impact of unemployment as well. And I wonder if I could coax either of you to say a little bit about that.
Well, unemployment, we always say that when unemployment is at 14% or whatever, it is 30% in the neighborhood. Because a lot of people have not been working. They've been underemployed or unemployed over the years. So unemployment is always higher in our Black and brown communities.
Yeah, and I think going back to a point that I made earlier, a lot of there are a lot of people in our community, in the Latino community, who are self-employed. And so haven't, either because they're self-employed or because they are in jobs where, again, because of their immigration status, they're not paying into unemployment. So they have absolutely no grounds on which to ask for unemployment. Of course, again, that's not the situation with everybody, but that there are significant numbers of people in our community for whom both of those things just make it difficult. And so there is no such thing as unemployment.
And so that also kind of negates that whole stimulus package. You know, people that haven't worked in years, they're not going to get a stimulus unless they do get Social Security or something, but they're not going to get that stimulus. So it's not going to every American, as we are told.
Or everybody who lives in this country and works in this country. Right?
Exactly.
And again, with the immigration situation, so they're paying into the tax system, many of them, but because they're not filing returns, there's no way of getting them a stimulus package. And the president is set on excluding people anyway. So even if there was a way to get it, he's adamant about excluding those people who are residing in the country without status.
Yeah. You both talked a little bit too about food insecurity, but I'm interested in these ways, as I say, that this present crisis has really revealed crises that were around us the whole time anyway. Kim, a little while ago, you mentioned food deserts, and I don't want to take for granted that everybody who's here with us tonight knows what you mean by that. Maybe both of you could talk a little bit about food insecurity in this great American city that we live in the wealthiest nation in the world. Could you talk a little bit about what food deserts are and what their impact is in the best of times?
Most of the time, there is not access to grocery stores. We, in the African-American community, there were, used to be like the Dominick's, and I'm just gonna say from 79th Street, there was a big Dominick's near 79th and the Dan Ryan, and then that went away. So then most of the time, the people would have to go to the little mom and pop stores. Well, then the mom and pop stores are usually owned by a foreign group. And what would happen is we discovered that a lot of the times the prices were much higher and the food was really sometimes substandard. It would be in that the expiration dates had passed. So you can go and look at things and it's like, this is not even good. When ketchup is brown, that is not a good sign. So those kind of areas, it's just not access to healthy foods, fruits and vegetables, those kind of items that it was just not able to get to. Recently, Walgreens, in the last few years, Walgreens has started to stock those kind of things, because in our area, there were these food deserts where people, you can't walk to the local market. You have to take a bus or something to get there. So there's not a way to actually have good access to food, to mostly healthy foods, fruits and vegetables, meats, fresh meats, at a reasonable price.
Yeah, I think in the communities that I'm most familiar with around Chicago, I think that the issue of food perhaps is not quite, I wouldn't quite categorize it in terms of food deserts. I think there are plenty. I think there is probably one difference between us and the African American community. Now, having said that, also we do lack a large chain supermarkets that are in existence in other communities, but I don't think to the degree that is, to my knowledge, at least what I know of in the Black community. But I think the impact it has, though, in this day and age, is because many of those places, the access to those places has been difficult because of the virus itself, and also because of the people who work there. That's how they're the ones who are affected. A lot of the employees, because most of the people come from around the neighborhoods. But it's not per se the food issue, I guess, is what I'm saying.
What brings us together tonight is a desire to raise a little bit of awareness about all of this through a perspective of faith and justice. But we put the word action into the title of tonight's program very much on purpose. One of the things that I like about this conversation and the opportunity it presents, I know many times we do get people joining us from around the United States and indeed other parts of the world, but a large number of the people who join us are right here in the Chicago area, in this area that we're talking about. The problems we have in Chicago are not so different, I think, from a lot of other places, and indeed there's been some good reporting lately about how the kinds of things we're talking about are a global phenomenon, not just unique to the United States. But thinking locally in a particular way and thinking about action, I want to ask both of you to imagine with me a little bit, if you would. We're all, to all appearances, locked in our homes for the next month or so, more or less, until maybe we return to mingling out in the world in a slightly normal way again. What can we be doing now? Is there anything we can be doing now to try to take action to address these things that we're talking about?
When you had brought up that question before, I was like trying to figure out exactly, what is it that we can be doing? I think one of the things, the thing that, and this kind of ends up being almost like 9/11, it has brought so many people together. I mean, you hear a lot of positive stories about people helping each other, and it's wonderful. It's absolutely wonderful. And people just being out there for each other and trying to do things to encourage each other. They have the free music concerts and all of that. Even the mayor has, Lori Lightfoot, Mayor of Chicago, has a make a mask, give a mask, wear a mask campaign where, people that have those sewing skills, I'm a little lax on that one, but have the sewing skills can make masks and bring them to different, it was a lot of different churches, St. Sabina is one of them, drop that off to give to our vulnerable population. Nursing homes have been hit very hard during this time. And, a lot of people, and it's so sad, a lot of people are dying alone. And so that's the heartbreak of this whole pandemic also. It's just the people that are dying alone. And so any way you can reach out to people, you can't go see them, but there's a phone. If you know somebody that's in a nursing home, or if you can connect with a worker from a nursing home that can connect you to a person, That might be a way. Just any way that we can just reach out to another person that and extend a helping hand. You know, we have this saying that at St. Sabina that, you know, once we leave the service, that we've been blessed and now we go out to be a blessing. So, you know, we need to be a blessing to others as much as we can during this time.
I very much agree with Kimberly and would pretty much repeat all of that. I guess the one thing I would add, particularly based on the comments that I've made and the things that I hope I've brought to light, the word advocacy comes to mind. And I think that as I look out into the on my screen and I see a number of you, and knowing that you're all friends of CTU in some way, shape, or form, and that I think I would venture to say that are interested and concerned with issues of justice. And you're on the computer, which means you're computer savvy. So a lot of advocacy can be done through computers, everything from contacting our elected officials about some of the issues that we've raised, and certainly the ones that I've raised. Again, right now, of serious concern is what's happening with the Supreme Court. And I know you can't exactly lobby the Supreme Court, but certainly our senators, our congressmen and women, I think ought to be pushed, and we ought to let them know how we feel about that. And I would hope that many of you, if not all of you, would agree with me, especially on the injustice of those young people, the DACA recipients, those young people who were brought here as children. You know, just another statistics. I read somewhere that there are approximately 29,000 young people in our country who are currently serving as doctors and nurses. That's 29,000 that we are saying we want to get rid of right in the middle of this pandemic. And so I think we ought to be vocal about that. So we can't perhaps join a rally physically, but certainly I think any advocacy that can be done in that direction. I think also, even just for ourselves, raising awareness of these particular situations. I think, Stephen, you spoke earlier, or maybe Kimberly brought up the whole question of the digital divide. You know, that's another situation that affects our community. Many of us may take for granted that we have a computer, maybe we have a desktop, we have a laptop, and we have a tablet, and we have our phone. And many of the homes in my neighborhood, certainly there are families that don't even have one of those. Or maybe they have a phone and now their children are being asked to do their homework, and there's 2 or 3 or 4 children in the home, and they're having to do their homework on the telephone, on the smartphone, or a tablet. And so I think there's, you know, or maybe they have those, but the internet costs money. And so, you know, I think those are the type of things, structural changes that we can begin to imagine. You know, Steve, you asked us to imagine. So can we imagine a city, for example, that offers internet, goes into every home automatically, things of that nature. And then of course, the whole array of issues I mentioned with the healthcare.
You know, I'd intrude as your moderator on the conversation just to say very quickly that I have a friend in California who contacted her congressional representative to express some concerns about the stimulus and who was going to benefit from it and who wasn't. And when she phoned in, she was told she was the only person who had called that day about it. And it's a scandal. That we do, as Marco says, that we do have this capacity with state government, with local government, with the federal government. And we have all this time on our hands, and especially if we have this communication technology available to us here. It's, I really want to underscore what an important way I think that is for us to try to make a difference with this time that we have. It's our city, after all. It's our state. It's our country, every one of us. I want to open it to questions and discussion in a moment, but I want to ask one kind of final wrap-up question for Marco and Kim at this point. And it's another hopeful and imagine with me question. You both answered the last question, I think, in a very creditable way as ministers, which has been the flavor of this conversation. We're a school of theology and ministry, and we wanted with this conversation to bring that perspective of ministry. And I'm very glad that we have. But, you know, thinking now about down the road, we know the fall and the winter are probably going to be tough again, and that this is going to go for a long time, longer than any of us wants it to. And I mentioned at the top, the lingering trauma that I think our experience of this already is revealing that in one way or another, we're all going to have with us for a long, long time. But with all of that as background, do you believe we can learn from this? Do you believe that there's hope that we can become a little bit better and a little bit more invested in one another? We've said the only surprising thing about some of these problems we've talked about is that we're surprised by them because they've been here the whole time. Talk a little bit, if you don't mind, about your hopes that out of this trauma can come something like a renewal.
Well, Steve, we are a people of hope as Christians, and you know, we just experienced, as almost the resurrection. You know, we just celebrated, you know, the resurrection, and you know, without a Good Friday, there would have been no resurrection. So we're in that Good Friday still period, even though we've gotten past that, and so I believe that when we look toward the fall, yes, things are going to be different. We have a new normal, as people keep saying. I don't think things will be back to where they ever were. We can always hope, though, that, you know, like these people are much kinder. They're willing to help each other, that continues. A lot of times, once we get past the crises, we go back to business as usual. So we hope that we won't go back to business as usual. We are looking forward to November and voting. So people to go out and vote for sure. We don't know what the election is going to look like, but as you're seeing that they're trying to do away with some primaries and different things, and suppressing the vote has always been an issue in again, African American communities. And so just looking forward to voting in the fall and being able to change the look of government that has really let us down during this pandemic. We haven't had the leadership that is needed. And so here we are at this point of emergency, a state of emergency. And the other piece would be going forth is, you know, as they keep saying, we do need more testing, more testing. We don't have testing, that means testing clinics in the Black neighborhoods. You know, they're beginning to open up here and there, but we're 6 weeks into the pandemic. And now they're, you know, so that's another cause for the numbers that we are seeing. We don't have the access to the testing. So in order to move forward, they keep saying, in order for economy to open up, in order for us to go back to doing some of the things that we're used to doing, that more people are going to have to be tested. So we have to advocate for that too, just to keep advocating for those things and our rights, so that we can continue to make this world a better place. I know Pope Francis wishes that you know all these injustices that have been happening. Well, this pandemic is gonna make everyone see the light. But we can always hope that we are moving to something new and better and more Christ-like in our interactions with each other.
Marco, the last word.
Yes. So one point is because I may forget. So Kim mentioned about the testing, and I think that one of the things we're talking about tonight, besides the race, is the whole issue of poverty, which we know crosses many borders and across many different ethnic and racial lines. And so I do think about when one thing will be for testing to be available. Secondly, who will be able to afford it? And so I think just for us to be aware of that. But kind of as a final word, I keep hearing people saying, can't wait for things to go back to normal, to go back to the way they were. And I cringe. I cringe because there's many things I do not want to go back to. I do not want to go back to a planet that is just absolutely abusing the life out of our earth, and out of our, which we're essentially doing out of putting ourselves out of existence, or at least running that risk. But also I do not want to go back to a society that has led us to this, where we have the haves and the have-nots, and how many of the divisions that unfortunately, we as humans have created are responsible, if not for the pandemic itself, certainly for those things that have caused greater pain than there should have been. So like Kim, I am hopeful that the good that has come out of this will continue. The sharing that has happened, the care, the concern that people are showing, the way people are putting their lives on the line for somebody else, that's what I hope for as we move forward.